For those of you that haven't looked at the statistics, the latest research and statistics, there are 2.5 million people diagnosed with pressure ulcers, pressure injuries each year. So that's a staggering number. And even more sad than that, 60,000 of them die from those pressure injuries. So this is a really, really big topic, and I'm glad that we get to spend some time on that tonight and learn some tricks of the trade and some ways to do to make sure that we are preventing pressure ulcers for those under our care. And for those living an active seated life, it's a big risk. So we want to address that and get to the meat and potatoes right now. So our expert, we want to learn a little more about Cheryl. She's going to tell her personal story, but she has years and years of experience in wound care as a wound nurse, educator. She's a clinical expert and content writer. She works with a lot of different organizations, and she's going to tell us a little bit more about those as we get going. So thank you for joining. Again, use that chat box for questions. We'll have time at the end to answer those for you. And now we're going to get to hear from our expert, Cheryl Carver. So now we want to dive in and really get to know you, Cheryl. I've told everybody a little bit about you, but how long have you been a nurse, and has all of that been in wound care?
Yes, so I've been a nurse 22 years, and it's always been wound care as a specialty. It's my passion, and I love my work. So I can tell you a little bit about that too.
Yes, jump right in.
Okay, so I was in the military, and I received a call one day. It was in 1996 that my mother had had a stroke. So I did eventually get out of the Army, honorable discharge, to take care of her. And after the stroke, she did have complications from her diabetes, which led to, a leg amputation. This entire time, I had no education, no background. I actually didn't receive any education from even the healthcare staff. We would go to the wound center once a week, and I really didn't understand what was going on. And so I started sort of immersing myself in, wound care at that time as the caregiver and the daughter. And after the amputation had happened, she ended up developing at that time what was called decubitus ulcers. She was in in the hospital where she developed them. And I was there visiting one day, and I rolled her off of the bedpan to help her. And there was this huge hole in her sacral area. I didn't know what it was. I had never been notified, by the doctor, or no nurse had said a word. And so, quite honestly, I felt sick. I didn't know what it was. So, long story short, after that changed my life for the first time. And she was transferred to a long-term care facility for skilled care. And while she was there, she declined. Her wounds had worsened. She did have kidney failure and other, chronic conditions that did contribute. But ultimately, she went into hospice care, and she was only 47 years old. She died in my arms. I mean, I watched her take her last breath, and it was from sepsis, from her pressure ulcers. So obviously my life changed at that point dramatically on what I wanted to do with my life, and how I could help save someone else from that happening to them. At first, I was angry, so that lasted a few years. I was depressed, of course, and grieving for my, loss of my mother. And then I decided to go to nursing school. So that's what I did. And so I graduated in 2000. I am a licensed practical nurse, had planned on going to get my RN, and then my husband had a stroke, and I ended up being a caregiver for him. So that's been 16 years now. So yeah, that's my story of how everything sort of occurred, and transpired to now.
Well, you took a tragedy and trauma, that is trauma, to go through that. And your mom was at such a young age.
Yeah.
And you've turned it into helping so many people not just here in the US, across the globe. So, you've taken something awful that nobody wants to go through, but now you're able to help so many people, and you have that personal touch with it. So you know what they've been through, and you know what they could go through. That's why
Right.
prevention is so important. So
And that
thank you.
warms my heart. That's why I do smile when I talk about my mom now. I don't feel sad like I did before because I know that I feel like it was a gift, honestly. So I'm happy with my work.
Definitely. And you're able to help so many. So that's what inspired you for this career choice. But on the side, before we dig in even further with the pressure ulcers and injuries, what do you do for fun? I mean, you have a lot of stuff going on, a lot of work, a lot of stress in your life. What do you do for you?
Well, I love being with my family. And so whatever we do together, that's my hobby. And I guess work is my hobby. Probably sounds crazy, but it's almost like free therapy for me. I am a caregiver, so I do a multitude of things to keep it, I try to keep it balanced. I don't think any of us have a balanced life, but yeah, enjoying my family.
Yeah, quality time's my love language too.
Yes, and I do love traveling as well.
Oh,
So
great. As far as what constitutes, I've worked with different in different settings with different populations, and sometimes we call them pressure areas, sometimes they're pressure ulcers, sometimes they're called wounds. What would define, how would you describe or define? You can teach me a thing or two.
well, I guess there's normally an ongoing debate about whether to say pressure ulcer versus injury, but in the USA, that's what we use are those terms and are acceptable. In other parts of the world, you may hear pressure sore, ulcer, just the word alone, ulcer. So that would pretty much sum it up for terms being used. But when you look at, the nitty gritty, it's all the same. Why is someone developing a pressure ulcer or injury? What can we do to prevent, these areas? And that's where I love when the world comes together. Once a year we have Worldwide Pressure Injury Day or Pressure Ulcer Day. We should be doing that, every day. But it is nice to come together once a year and be able to spread even more awareness because if you can even spread awareness to one person, it does make a difference. And
For
so
sure.
every year I usually, I'll do a video or, like with my family, we actually have pressure ulcer cookies every year. And it sounds silly maybe, but my family knows, how to prevent, both of my sons, they've been, helping with caregiving since they were 10 and 12. And so like if I do go out of town, they know what to do. And that's what I'm talking about is
Mhm.
we are we are all a caregiver at one point in our life, whether it's professionally or a family member, or if we're a parent, everybody is at one point in their life. So everyone should know this information. I didn't know anything. So when all of this happened with my mother, that's where that anger was like, why didn't anybody even notify me or teach
Exactly.
me? So that's what my mission is. You were talking about care settings. We have different, regulations or guidelines depending on the care setting. But again, it all goes back to that prevention and how is that implemented? Are you educating your staff ongoing? Those are the things that I feel like, we have gaps, whether it's transitioning someone from hospital to home, or maybe if you're working in a wound care center. So I did that 13 years, worked in the hospital, case managing, treatment nurse. I've done it all but home care. And I would identify those gaps probably before someone else because I had it happen to me or my mom. So I do feel like I always have this, I don't know, a prevention mindset, I guess.
Yes, I was going to say
Um,
that you helped
yeah,
us with the title, mindset matters, and I think
yep.
you make a good point without making the direct point, but I'll point it out. You it's all about, the family and the people that don't know, but even the people that should know or
Hmm.
should know more in the medical field
Right.
can gather more information and more research and learn what's up to date. And their mindset matters too. It's not just, oh, there's a pressure injury, let's go work on it. We need to shift the medical field into prevention too. So I think your title for Mindset Matters really
Hmm.
does hone in on what's needed. It's not just people like you that didn't know anything, but now you teach everybody, and the caregivers are so
Hmm.
important, and to especially that gap you talked about. But also we have to get the word out on people that maybe should know more than they do.
Right. I mean, even when, you're talking about seating surfaces or any type of offloading device, even applying an offloading device correctly and making sure that the caregiver knows what to look for. And, maybe if they're offloading the heels, is it truly offloading that area? You have to check.
Are you
Um,
adding pressure to a different area? As a
yes.
as a clinician, we have to watch that too. Yes.
Yes. And all of the equipment, that's where I used to do rounds in 5 different nursing homes. I was, overseeing the wound care program. And that was the thing. I was always teaching the nursing assistants. And then if there was a caregiver or a family member there visiting, I would bring them and get them involved. And you must keep the patient involved as well.
Yes.
I see that so often. You have to have it. It's a team, and we read that all the time in different literature and things. But do we do it? That's my question. So
I
we
know
have to
exactly
ask
what you mean.
ourselves.
I can
Yes.
envision everybody talking around the patient, or even if they
Hmm.
have a cognitive deficit, include them in part of it.
Yes.
Talk to them as part of the team. Exactly. This is the expert really, because they're dealing with it. So
Right.
that very, very good point. So you can jump now, shift over to some things that we can do for prevention.
Well, number one, the largest organ in our body is the skin. So, checking the skin every day, and that's head to toe, really making sure, you're looking in the folds and creases, even. Skin sweeps are very important. So that would be number one. And then also, how do you take care of the skin? We want to protect the skin, whether that's barrier creams, just making sure that that skin is healthy and good condition. And then the other thing would be, if you are using different devices or equipment that helps prevent, are you using it correctly, or does it even need implemented? First off, there's risk assessments out there, and we all know, we do those mattering on the guidelines. But again, if you have that mindset that you're putting prevention in place, we need to be one step ahead. So I can fill out many risk assessments, but I feel like we need to be one step ahead always, even from, everybody is at risk. That's how I think all the time.
Exactly.
Yeah.
And
So,
what's the action after? So you can fill them out, like you said, and pile them up, but what's the action associated with that risk? What are you doing to prevent it? And
immediately implement within 8 hours. I like to do it within two, but I'm not hands on now. But I mean, I was literally rushing to get those things in place and had the doctor on the phone. Even if you have standing orders, make sure that they are already, implemented so that we are protecting their skin.
so
Um,
many people in my experience. So
mhm.
clinically, I like those steps. And then when I come in as a clinician, people think sometimes that the patient, the resident, the person is getting enough
Mhm.
hydration and enough nutrition, protein, and that's somewhere where I'd like to tackle in there too,
Yes, for
because
sure.
I'm thinking of my little old lady, and she might have a cognitive deficit, and the cup's there, but is she taking in the hydration that we want? So that's I would throw that in there too, because a lot of times we just assume people are taking in enough, and they aren't, in order to, as a preventative measure.
Right. And nutrition plays a major role in wound healing, and it's often, we don't focus on that, and I'm not sure why. It made me think of when you said hydration. I remember the days when we used to have people go around and, fill up the pitcher of water. I don't see that as much now. And I also think about how much I drink water a day. And if you're being given a cup of water with the pill pass, that's not enough.
Right.
So, that's what I think when I hear hydration. So, and that, plays a big part on the skin, of course. So, yeah, definitely. And I also always think about, the therapy department. I like to get everyone involved. The therapy department, a lot of times is left out, and I don't know why, because they can help with more movement. We want to keep them moving if
Yes,
possible, and that's what it comes down to. And also those other mechanical forces that are involved, pressure, friction, shear, moisture, all four of those that's what contributes to a pressure ulcer and can, they can decline. So
definitely. So my role on my side would be to join with. So hopefully the clinicians watching and or the therapy clinicians and the nursing clinicians, knowing that we have to work together on this. It does take a village. I know that's a cliche
it
thing, but
does.
it really does take everybody, and including the patient. I love that you pointed that out, and the family, and then we can bridge those gaps and keep prevention going
Yes.
even when they're out of our care. So, and I would correct you though, because you said home care isn't one of your things. You do home care every day.
I
So
guess that's true.
I'm
Yeah.
not letting I'm not letting you get off the hook. You've pretty
Yeah,
much
that's
covered every
true.
setting.
Yeah, I know it as the caregiver for sure.
So the positioning devices that you talked about, I mean, of course, we have our orbiter cushion and
Hmm.
the fact that it helps relieve that the pressure in the bladders, and it's based on the science, it's based on the research. Love it. I like to tackle in bed, out of bed. Are there certain things that you like to stay away from? Are there certain things that you are like, in some cases, this is kind of a go-to?
I think the first thing I want to point out is no matter what type of device or seating surface that you're using, you do want to learn about what the technology of that is. They're not all the same, and they may seem that way. I always talk about that with wound dressings as well. But we want to think about the weight of the patient, how to take care of, whether it's a seating surface, again, education, and thinking of what is the exact device or seating surface that is needed for that patient, and then educate them on how to maintain it and things to look for. So, with the seating surface, I start thinking about, do we need a gel or viscoelastic foam, or, for a low risk or a high risk? And, whether it's a 2 inch, 4 inch, I'm always getting into
Right.
those, the nitty gritty. So that's what I'm always looking at, is what is most appropriate for that patient. Positioners, I mean, a lot of times if you're working in a hospital, there is a certain formulary that's followed. So, I mean, I guess the thing about picking and choosing, I don't really have a answer to that, but I would definitely make sure that it is the right device for my patient.
And used properly. So, and it
Yes,
is
used
very
properly.
individual. It is very individual. I just didn't know if there were certain ones that you would go to. What about back in the day?
Mhm.
Every turn them every 2 hours. Is that still kind of what people are being educated on, or is there a different time frame, or is it still individualistic?
I believe you're better with individualistic, if I can get that word out.
I
Um,
don't. I may have made it up. I don't know.
again, I like to focus on the patient. If they need repositioned every hour, then do so as long as
Right.
they're comfortable. And then with seating surfaces, every 15 minutes, if they're able to, sort of shift that weight. If not, then the staff or at home would have to do that. But really, making sure with those skin checks as well, then what that tissue tolerance is.
Exactly. So out of bed, I feel very confident, and hopefully a lot of our viewers do. In bed, I think is a little more complicated when somebody does have a pressure injury, a pressure wound. In bed isn't gonna help, but being out of bed sitting, so we have to find that balance. But is there a certain type of mattress that you've seen used?
Yes. So there's, you have your gel overlays, you have your low end, which is, preventative, but you have gel mattress overlays, and then there's low air loss, alternating air. So a lot of times that's driven by, reimbursement on what you can get or not. Obviously, there's also ways to pay cash or rentals. But, that's the part that's kind of tricky on, how do you get that specialized bed? And I'll use my mom as an example again. I remember when this all happened with her, we needed to get a bed. And, they're very expensive. And she was on Medicaid and didn't qualify at that time. And they actually ended up letting her use one for 30 days. They donated for her to use that. And, I just got goosebumps because that's what I'm thinking is, there are programs out there. They all have some, different names, but always check into those types of programs as well, because, if you can get it even for 30 days, maybe after a flap, procedure or what have you, that wouldn't be preventative, but it is after you have the surgery.
Sure.
But just giving an example, with some of those equipment and devices.
Well, you've been through it, and your mother went through it. So the emotional impact, can you speak on that at all for the family, for the actual person going through this?
Yeah, I remember my mom telling me that she almost felt like she was in a jail cell because, especially when she was on the bed, and just being bedridden, period, she just felt, the isolation, the anxiety and depression, it kept, it was chronic at that point. And me as the caregiver, and I still go through those types of things now, you know, I feel helpless. When you have a loved one, that's how you feel when you can't change what's going on, especially when, she had developed, the pressure ulcers and everything. I think back now and I think, oh my goodness, if I would have been educated, I could have maybe prevented, but I can't think like that now. But yeah, you have a yarn ball. I call it a yarn ball of emotions on both ends. Yeah.
And feeling like she was in jail, and you feeling so helpless.
Yep.
That is a lot of emotions going on. So
Hmm.
what about the organizations that you're working with? Can you tell us a little more about those and how we can learn more?
Yeah. So, whether you're, a caregiver, a nursing assistant, and on up, being involved in wound care, I'm going to say skin care as well. If you do participate or become a member of an organization, that is where you have more resources. And I know that's what I did. So I am a member and a board of directors for the APWCA, which is the American Professional Wound Care Association. I initially became a member because I wanted the education. And now here I am, board of directors. I would have never thought that. And we continue, to make sure we're there for the clinicians. And then I also am involved with the AAWC. I've been a member for years. And again, education, getting those resources to everyone and making sure that we keep that education ongoing. And, both of these organizations have annual conferences. So that's another way to get, if you are a nurse or a doctor, you can get your CEUs or CMEs. I'm also vice president of the International Alliance for Wound Care Scholarships.
Great.
And so we give, nurses or therapists or any licensed healthcare professional really an opportunity to enhance their education, becoming certified in wound care. And then I I also, about what's been a year ago, I am a justice ambassador for prison fellowship because of personal experiences. My son had a wound And so that it all, it's kind of crazy how it all kind of weaved together. But I'm trying to educate, and sort of get myself in there more involved with the lawmakers and just how wound care is delivered in the correctional setting. So,
And that's a population that not all of us think of when
right.
we think of,
And I
but
didn't either.
people young and old can have skin injuries.
They're
But
in a wheelchair or
right, but
yeah,
the older population, I mean, people do age in jail. We don't think of it that way. So
right.
yeah, that's
And
wonderful.
there's a lot of quadriplegics. We don't think of those things,
No,
and they have limited dressings in most of the correctional facilities. So I'm trying to think if there's any other organizations I'm involved in.
I'm
It's
sure
getting
there
to be a
are.
long list. Yeah. So, yeah, I
But
think
this
I
is
covered
great.
it
And
all.
I really hope that this inspires other clinicians to think, okay, what more can I do? How more can I get involved? And
Never stop learning.
yes, lifelong learning and make a difference
Yeah.
beyond just maybe the people we have under our care now. There are people we can help. I mean, definitely help those people, but they're, family, friends, and then
Right.
other organizations. So on that note, if I am new to nursing, if I'm new to wound care, we've given some preventative steps, some good points there. But if I clock in and now somebody has a pressure injury and I've got everything I'm supposed to do, there's orders there. But if I see something different, I'm going to get with the physician, of course. But how could I, as a new clinician, know kind of what to do or what to ask the doctor for? Where would I find that information?
Well, hopefully there is some sort of wound care program already in place, but I will tell you, when I first started in 2000 as a treatment nurse, there was nothing. And I pretty much on every TAR at that time, our treatment record, it would say the same thing: offload the heels, turn and reposition every 2 hours, and you read through those. And a lot of times, I mean, I just noticed, nurses checking them off. For me, I know I would literally just make sure that I would go by every room and see if their heels were off the bed. The education needs to be there. So if you have to go to the director of nursing, or if you're, in the hospital, they have a lot of guidelines already
Mm-hmm.
or protocols there, algorithms, those are in place, but you need to really tap into those things and want to learn how to, all of these different skills. And there should be education ongoing. A lot of times it's quarterly, it could be monthly in services. And I know when I had my business, I made sure that I provided, education every month to so many different facilities. And I did forget to mention, I have been a content writer as well for almost 9 years. And that's, all of those educational tools,
Yes.
share the knowledge, and those protocols and algorithms should be in place. So if you're working somewhere and you don't have those, or you can't find them, find out, how to get to those and learn more.
And they could join organizations like you did to learn
Yes.
more. And then to piggyback on what you said with continuing education and lifelong learning, I think they could gear their education, their CEUs, you call them
Mm-hmm.
CMEs, they could
Yeah.
gear those towards that direction and become specialized in that area.
Yes.
Because I feel like if you can take care of someone's skin, and it sets them up for success for everything else they need to do in their life,
Right.
in their day. So it's a great place to start
And when you're in
with a
nursing
specialty.
school, whoops, sorry.
Yeah.
When you are in nursing school or residency, what have you, I read some literature that they get 2% education on wound care.
Oh, wow.
So yeah, and I mean, it made me think of something else. I was on TikTok yesterday, and I seen a clip. It was residents, and someone was asking them, "Do you know how often you should turn your patients?" and the one said 5 hours. And they're going to be doctors, so it's just another example that that education is not there.
Right.
The focus is not there, I guess I should say.
Well, that's your next job. You're going to get into the
Yeah.
medical schools and teach them. I'll just sign
Yeah.
you up for lots of stuff.
Right. So,
Well, you have answered all of my questions, and it's really your story and the things that you're not finished. You have so
mm,
much that you've worked on and done well, and then there's more, like with the prisoners and corrections and all of that. There's more coming, so we will
right.
definitely have you back to learn more. Anything you want to let our viewers know before we sign off?
I think just, that mindset, it does matter for prevention, and then never stop learning, because it does only take, one person to make a difference. So that's what I would leave you with today.
Great. Well, now we want to open it up for questions. So we're going to let our viewers put their questions in the chat box, and then we will, be answering those. So this is a great time for you get your questions together, viewers, put those in, and we'll be answering those right now. All right, you have people thinking already. And the first question I see is about other places. So we talked about corrections, but are there other places we don't often think of that come to mind for you, Cheryl?
I think of assisted living for one. You're not really supposed to have any types of wounds living in that care setting over, especially for pressure ulcers over stage 2. But, think about skin tears and other types of wounds that, I think we always think of nursing homes or the hospital, and it can be anywhere. So, every type of setting would be my answer to that.
Assisted living is a good one, though. I didn't think of that one.
Yeah, I mean, we just automatically think because they're more independent that, they wouldn't have a wound.
Somebody put on here group homes. Sometimes
Yes,
people with
definitely.
disabilities, group homes.
Yeah, we used to get patients from the group homes quite a bit. Again, it can happen anywhere as long as you have skin.
Right.
So,
All right. Any other questions? Anybody out there? That was a good one that somebody brought up, because even when you brought up the corrections, that was new for me. So it makes me think
yeah.
more globally too, and not just in my little box where I'm used to treating. So that was a very good question.
Yes, it was.
I'm checking the question and answer anything. So what about, looks like one more. It's a quiet group, but that's okay. Are there any standardized assessments when looking at wounds or staging a pressure injury?
Well, that can depend too, what care setting you're in, but there's normally a tool in place, for risk assessment or even on how to stage. Some of the settings even use more of maybe a digital imaging tool that can help them at the bedside.
Oh,
So
wow.
maybe it's more of automated measuring or even being able to describe what the wound looks like. So like, even if it's maybe a medical assistant that's working in a certain type of care setting, there's more technology that's able to help us determine, the depth of the wound, determining the tissue types and what etiology, all of those things. But, ultimately the doctor is who actually diagnoses,
Okay.
that wound type or staging.
And then they would know those standardized things to use.
Yes.
Good. All right, one more question, and then I want to show everybody, so don't leave. We'll do one more question, then I want to show everybody the different organizations. So I did make a slide for that you mentioned. And then when the recording goes out and we share this with all of our colleagues, they'll have that information too, because the whole point of this is to get that education out. And I know that you're a big fan of that too.
Yes.
So this one is, ooh, it's a good one too. What if I can't do a check on them? Maybe it's a family member, maybe they have a reason, or maybe it's a cognitive impairment and they don't want you checking. Any tricks of the trade there? This is a hard one.
I find that just trying to reapproach, just keep trying to reapproach. Maybe even with someone with dementia, you might have them doing something else, or even when you take them to the bathroom, trying to distract them. I know here at home, I always get, both of my 6'5" boys to help with my husband. So, you do have to check the skin. So
Use your
however,
resources. Exactly.
yeah, if you, have to think outside the box with that, do anything you can, to get that done. And if you educate them, sometimes it makes me think of some patients, especially the ones that are older, they don't know what a pressure ulcer is or a pressure injury. So if I use the term bed sore, their eyes light up and then they know what I'm talking about. So that's always, something to remember, is how you communicate with them.
Another person said that we need to educate on pressure injury more and more and more, and programs like this and you speaking out tonight really do help. So thank you for that comment. And then we need to throw more light on paraplegic patients and the pressure injuries that they're at risk for, to prevent further pressure injuries. So thank you for those questions and comments. And these are the organizations that Cheryl mentioned and things that she's a part of. And like I said, this will come out with the on-demand recording. That way people can find out more, because somebody could be like our example earlier. I'm brand new, I'm out in the field, but I want to help people. And we don't know what we don't know yet, so going to these courses and being a part of these organizations, I think it's really, I can tell it's made a difference for you.
Yes.
You've happened upon this passion of yours, and other people, they want to do that too. So, and somebody's very happy that we did this tonight. They said we were awesome. I'll read that one too. And if
we
you
always
are,
learn from each other,
exactly. Exactly. And if you want to learn more about Kalogon and our orbiter cushion, please email me at education@kalogon.com. We can get an in-service for you and your team. We can give you more information, because we are in the job of helping people and educating. So we want to get that information out there too. So please email. So that will come out as well. And each month we will have somebody awesome like Cheryl, maybe not as awesome, we'll try, to just share some more educational information. And Cheryl, I cannot thank you enough for this, and we will have you back, because this is a topic that we want to talk about often and get the word out. So thank you so much for being on.
I enjoyed it. Thank you.
Everyone have a great night, and we'll see you next month.
All right. Take care.
Bye.
Bye-bye.